And the Gauteng Human Settlements and Urban Planning MEC Lebogang Maile says he will study that report and provide a comprehensive response to the report in due course. Let's return now to our top story. Health Minister Dr. Zweli Mkhize confident today that government will reach its target to vaccinate 40 million people. Of course, he, along with the President, Cyril Ramaphosa, among the first batch of people to get the Johnson & Johnson vaccines today. A very important moment marking the start of our COVID-19 vaccine rollout. I'm joined now by the Health Minister. Dr. Zweli Mkhize, thank you so much for joining us. I know that it's been a very intense time to get these vaccines rolled out today. Why was the need to move so quickly?
Well, it was important for us to move quickly because you recall that we have been waiting for vaccines to have all the tests confirmed. And then we have just been through a very difficult wave, which has taken its toll amongst our people, and particularly the health workers and other categories. And so we needed to start as soon as possible. Initially, when we had the COVAX facility, they were indicating that the vaccination could start as late as April. So we made every effort to make sure that we bring that closer. And so we started this afternoon. But in fact, we were also wanting to close the gap that we had initially relied on the Covishield AstraZeneca vaccine. But because of the challenges that we have still to resolve, we then felt it was important to find another way of moving on without changing the dates of the vaccination program.
Now, you had the jab today as well. I want to know, did it hurt? Have you had any adverse reaction? And I know that you had COVID-19, so why do you need the vaccination as well?
Well, firstly, it didn't hurt. We just had a very comfortable, I think even the staff are very gentle, and so there was no signs whatsoever that anything was happening. So I would say that just a slight burn that you would get, but it disappears quickly. Secondly, there is no requirements to do your test for COVID-19 before you can actually be given a vaccination. But in our setting, there's a slight challenge in the sense that even though we could assume someone could have had antibodies to the COVID and therefore doesn't need to be in a hurry to take the vaccine. However, in this case, we've had a variant which has been very strong in the last wave, and so we believe that many people were actually afflicted by that, and that's the one that we really want to protect a lot of people about.
And I know, it's all about that third wave, which we understand is probably going to hit us sort of mid-May, perhaps June sometime. So bearing in mind that you've got an eye on that third wave and want to try and keep it as minimal as possible, how many vaccines are you hoping to have put into people's arms, let's say by middle-end May? What's the goal?
Well, it's a bit difficult to give you that date, but we will have about 500,000 vaccines which should be done between now and end of March, and then in between we hope that we'll get new vaccines that will come from Pfizer manufacturer, and so we want to push that one as well. By the time we get to June, we would have possibly received very close to 10 million vaccines, and so we're hoping that we'll be pushing as much of the vaccination as we get the numbers. But the exact number I can't give you, and just give you a sense as to what it looks like from the preliminary estimations.
Okay, so you're saying 500,000 hopefully by end March, and obviously then by April, hopefully it's absolutely thundering through. Do you think that we will have reached enough vaccinations, particularly among healthcare workers, people who are at risk, to make a difference once the third wave hits, or not?
Well, we don't know when the third wave will hit. We want to vaccinate as many people as possible so that they are safe before the next risk comes in with the next wave. So we will continue, but we must also remember we have said that whilst the vaccination is going on, our people must continue to use mask distancing and making sure that we sanitize our hands and wash our hands, because that is what's going to help us to delay the next wave and also to limit the impact of it, even if it comes up. So we need to keep the combination ongoing, and we shouldn't rely on the vaccines only for the third wave. We must rely on our own containment measures that we've already known that they work.
So what do you think? Do you think the vaccines won't make a difference in terms of the third wave?
I hope we don't try to distort this issue. The point is that the vaccination program is going to go on for the whole year, and people will remain vulnerable throughout that whole period. And so we expect that the only time we will know that people are safe is when we've actually recorded zero cases of COVID. Then we know that people are safe. That would probably be sometime long after the end of the year. So we need to make sure that we don't misunderstand that whilst there's a vaccination process going, we must also continue to use the masks and distancing and washing of our hands. It's going to be like that throughout the whole world, and there is no cutting corners. We have to really keep to the two, as has been advised by the rest of the world in WHO.
Yeah, so we're in for the rest of the year to be really, really careful. Can you tell us how you are prioritising who gets the vaccine? Because already we're getting people saying, well, so-and-so should get before this person, before that. We know that initially there's a limited number of vaccines. How is it working? Are you choosing specific people in risk areas of private and public hospitals? Are people putting their hands up? How are you organising that?
We have registered, as of this morning, 400,000 health workers that need to be vaccinated, and so we will make sure that we cover as many of them as possible, and I'm certain that the number is going to be increasing because of the enthusiasm with which the vaccines have been received. So we are prioritizing health workers. Wherever they are, they need to be prioritized. And then after that, we're going to focus on the frontline workers. There'll be teachers, there'll be the taxi drivers, there'll be the rest of the others.
So, Minister, what I'm trying to understand, is it first come, first served? Or do you deliver, 2,000 batches to Baragwanath and then let Baragwanath decides who gets what? How is it working? Is it first come, first served in terms of registering? Or does each hospital get to decide, or do you decide?
No. Well, the national department does not decide. What then happens is that there is an electronic vaccination data system that will actually indicate to people when they should come and get their vaccination. But we also combine that with anyone who walks into the vaccination center should be given attention to, because in any case at the moment this is the beginning. So we believe that health workers, whoever can reach the center, would be able to get there. Those will be invited to come over so that there's a reorganization of the vaccination program. We also will follow that. But the decisions are taken at local level as to what they can do and which people they're actually wanting to invite. But they're also open that if anyone, let's say there's a health worker who is unable to register online, walks into the center to say, well, I don't know, I can't read, or I can't use the internet. So we then say, okay, if you can confirm what a health worker, then that person will be vaccinated. So it's a combination of approaches to make sure that nobody gets left behind.
Very quickly, when is it going to private healthcare workers?
They will also be included in this whole batch. At the moment, as we're talking about health workers, we're talking both public and private. We're talking about general workers, we're talking about professionals, we're talking about administrators, we're talking about everybody. At the same time, we believe that all of those people who can reach out to the vaccination centers should be given priority. They should be able to get assistance. And even those who the management believes that they are in an exposed area, they must also go in front. They must also be activated to go and get a vaccination.
Well, Minister, I wish you best of luck with the project, which is called eNCA, Professor Gail Becker tells us, and I believe it's been an extraordinary effort of South Africans working together. Let's wish you every success. Thank you very much for your time this evening. That's our Health Minister, Dr. Zweli Mkhize, telling us that, of course, it's all hands on deck. They're hoping to have vaccinated 500,000 people by the end of March. But he is warning us that while those vaccines are going to be administered through the year, we must still stick to the protocols. It's wearing the mask, it's social distancing, it's washing your hands. We have to keep that up throughout the year.